Today, what we want to present is the work the FAO has been doing to understand the contribution of livestock, terrestrial animal source foods to nutrition. It is part of a large 4-5-year project, which is split across 4 different documents. And here we'll present the results from the first and the second document. The first document has been released a month ago, and you will be shared. All the links are already on the ANH website. Without further delay, let me just invite Tikian, who's going to be presenting the first section.
All right, great. So my name is Xiao Tikian. I'm a Nutrition and Food Systems Officer from the FAO, representing the Food and Nutrition Division. Okay. So just to say a little more about the set of papers, these are the first 4. Then we're going to present. There are 4 papers. We're going to be presenting the first 2. The first one is going to be on the contribution of terrestrial animal source foods to health and nutrition. And the second one that Mirush is going to present will look at food environment. There's also going to be 2 other papers on food security and also the contribution to sustainability, let's say. Okay. So, yeah, without further ado, let's move on to the next slide. Okay. So there are evident disparities in the supply of terrestrial animal source foods in the world. In our assessment, as you can imagine, high-income countries and even some parts of Latin America have a much larger supply or access to terrestrial animal source foods per capita than low and middle income countries. Okay. We found that in children between 6 and 23 months, within a 24-hour recall period, there were significant disparities in consumption between the wealthiest and the poorest, even within the low and middle income countries. These data were obtained from population-based studies. So just a little bit about the assessment that we conducted. We used PRISMA standards that looked at healthy individuals only. We looked at mainly consumption of unprocessed terrestrial animal source foods as part of a usual diet. So as much as possible, we also compared this against other components of the diet, and we looked at the contribution of terrestrial animal source foods to anthropometry. So the prevalence of stunting, wasting, obesity, and so on, biomarkers, morbidities, development, allergies, sensitivities, and mortality risk. In terms of the literature that we looked at, we mainly focused on peer-reviewed literature, but also gray literature, unpublished literature that might come from different organizations. However, the highest recognition was given to systematic reviews and meta-analyses that are published, of course. Oh, sorry. One more point. Most importantly, the studies looked at both the health benefits and the health risks. So we'll be looking at both in the coming slides. Okay, firstly, the benefits. Let's look at the more positive aspects of this. Here are some examples from different life stages. So looking at milk and dairy products, there's substantial evidence across different life stages for the positive effects of consuming milk and dairy, particularly the lower fat varieties. For example, during pregnancy, it can increase birth weight. In adolescents and children, milk and dairy can promote growth. And in adults, reduce the risk of non-communicable diseases such as obesity, cardiovascular disease, type 2 diabetes. And in the elderly, even reduce the risk of frailty and cognitive decline. In women of reproductive age, consumption of eggs demonstrated positive effects, whilst in the young, there were mixed results. Consumption of meat improved iron status in adults, and in lean meat, for lean meat, improve the muscular health of older adults or reduce the risk of conditions such as sarcopenia. Okay. Next, we look at the risks associated with terrestrial animal source foods. One of the most well-known risks that's often cited is with the consumption of processed red meat. So even in small quantities, that is associated with a number of non-communicable diseases, such as cardiovascular disease and cancer, particularly colorectal cancer. However, with unprocessed red meat in moderate quantities, there was minimal risks associated with non-communicable diseases. And for consumption of milk and eggs, the evidence is still inconclusive in terms of association with cardiovascular disease and stroke. So aside from that, we looked at policy documents as well, looking at food-based dietary guidelines from all 95 countries, and as Ramani mentioned yesterday, it has been expanded to about 100 now. There were also other documents that we looked at, non-communicable disease guidelines, national laws, regulations, and policies on nutrition. Most recommendations were linked to either micronutrient intake or the risk of non-communicable diseases associated with terrestrial animal source food consumption. In only 6 countries were environmental sustainability considerations mentioned, with quantitative recommendations only available in the Netherlands. And last but not least, Denmark and Sweden made reference to animal welfare guidelines, but only those 2. Just an additional point on this slide here. Most of the studies, the documents mainly gave recommendations that seem to skew towards evidence from higher income countries. And they tended to recommend sort of consumption that might not be as relevant to the lower income countries' diets. So that's something that Ramani again highlighted yesterday, the importance of the more evidence-driven recommendations. But that's something that we can go over later. Okay, so the assessment also covered other emerging topics. These are becoming more interesting in contemporary research and discourse. For example, the microbiome. So the gut microbiome has shown to have positive benefits to health. And let's say, consumption of probiotics or the promotion of gut microflora has been shown to have a positive effect on reducing the potentially harmful risk associated with excessive red meat consumption, whilst fermented dairy products can even promote the increase the amount of gut microflora and reduce the risk of inflammation. Insects have traditionally been consumed in some countries, but they are becoming more popular and at a global level. They offer a range of micronutrients that can also be found in many more common terrestrial animal source foods, such as iron and zinc, and can be a potentially more environmentally sustainable nutrient source. But there is more research that's needed on food safety, and also in terms of how this can be made more culturally acceptable. There are also commercially available plant-based alternatives. However, most tend to be deficient in some essential nutrients, and they can also be made with a high amount of fat and sugar, making them a less ideal alternative. More research is also needed on their impact on the environment and the food safety, their alignment with food safety regulations. Finally, looking at the omics, studies in Ecuador and Malawi showed some positive impacts, for example, of the effect of eggs on biomarkers such as child blood plasma. Analysis into these sort of biomarkers might be useful in further elaborating on the effects of consuming some terrestrial animal source foods. Okay, last slide here, just looking at some of the gaps and recommendations for further work. There's a considerable evidence gap in certain age groups, particularly in older adults, although research in school-age children and adolescents is also limited. Most studies also focus on red meat, dairy, and eggs, and tend to neglect other sources of terrestrial animal source foods, such as poultry. So, yeah, one particular point is that, as I mentioned earlier, there's no clear consensus on the reference range for terrestrial animal source food consumption. So more quantitative analysis is needed. At the moment, the ranges are quite large. They can range from 7 grams per day to 90 plus. There's also several opportunities for further research. One is to look at the direct impact of terrestrial animal source foods on healthy diets. As I mentioned earlier, closing the gap between the, let's say, policy and practice with relation, especially to the lower middle income countries' guidelines. There should be country-specific quantitative analysis that is done. And this should be in line with the One Health framework and with the trade-offs between human health and environmental impact objectively considered. Okay, yeah, that concludes the first part of the presentations, and we're going to hand over the floor to Alex to moderate some Q&As.
Right, so I will present the results from the second document where we looked at the food environment for terrestrial animal source foods. We've discussed food environment quite a bit at the conference, so I think this will be very useful for the participants here. We did the classic thing of trying to understand where the evidence on food environment for terrestrial animal source foods is at the moment and what we can learn from it. So this is the Prisma diagram for the review that we've done. So we've done a scoping review to understand what the literature says and where the evidence stands at the moment. In total, we had 217 studies from both gray and peer review literature. We applied the food environment framework that is developed by the ANH Academy over the last few years. And the results particularly say that majority of the studies were non-experimental and use cross-sectional data only. Very few studies were longitudinal in nature and primarily quantitative and analytical methods, and a very small percentage of all the 217 studies use mixed methods or qualitative methods to analyze the data. The evidence was primarily from high-income countries, as you can see on the I think the left-hand side graph. And even within high-income countries, the evidence focused more quite a bit on North America, US, and Canada particularly. And the biggest gap that we found here was that evidence from low and middle income countries was sparse, and therefore more work needs to be done in understanding what the food environment for TASFs looks like in low and middle income countries. This is a Sankey graph trying to explain the correlation between food environment domains. We analyzed the 217 studies by each domain from the food environment framework, and also try to understand which domain was discussed in relation to which food group from the animal source food groups that we were concerned about. Most studies focused on availability and desirability. These were the two domains where majority of the evidence stood. In terms of the food groups, milk and dairy products had most evidence, and meat in general. So the key takeaway that we found from the scoping review is that TSFs are usually studied together with other foods. So it'll be a study of a diet diet as a whole. And so meat and other TSFs would be studied in correlation or in conjugation with the food group. So not much focus was particularly given to animal source foods, unlike fruit and veg, where a lot more work has been done in literature now. A few studies looked at offal and insects, or honey and bee products, and other TSFs do not fall under categories that we've listed over here. And categories that we've listed here are eggs, poultry, bovine meat, mutton and goat and pig meat, and meat in general was aggregated all the meat types. There is good evidence on price and demand elasticities of TSFs, and in general, TSFs are supposed to be elastic across board where there is evidence, and same with affordability. But so the affordability and price studies usually was studied together because they look at demand and supply elasticities of consumers and what is available in the market. Where there was paucity of data was around food safety. So we specifically focus on food safety given the correlation between animal source food and their perishability and nutrition. So a lot of work has been done on that relationship. So we wanted to focus on food safety. And I think this speaks to the other side event on food environment earlier this week, where people did ask questions around how do we fit in food safety into the food environment. We were thinking of food safety very much as part of the vendor and product property domain, but we wanted to understand the relationship between food safety and animal source foods and nutrition better and in depth. So we did focus a lot on food safety and found there were very few studies that looked at food safety. And same with convenience and with convenience and vendor and product property. So in low and middle income countries, the studies primarily focus on desirability. I think that's worth mentioning. However, desirability has so many different aspects to it, from preferences to the way people consume food, cook food. And so within each domain, in each aspect of the domain itself, we couldn't really synthesize much information. So there is a lot of evidence gap there. Okay. So I think I've kind of already focused on most of these things, but the key takeaway messages from this scoping review is that there is paucity of evidence for high quality studies, and there is which highlights like the need for improved study design, specifically to look at TSFs in a disaggregated manner, as in looking specifically at the pathways of change where, from within the food environment to consumption and acquisition of animal source foods. And the evidence to study the causal relationship between the drivers and acquisition or consumption of animal source foods is limited. So we should be focusing on that in future work. There is more to be understood around how different food groups within animal source food are acquired and consumed, because pathways, as I said, are differ from, say, dairy, eggs, to offal and wild foods, and there's limited information on how wild foods are acquired from the local food environment. The next study I want to briefly focus on is landscape mapping of policies for TSFs. So we also wanted to see what determines, in terms of policy, how people access terrestrial animal source in particular. So this is not about aquatic animal source foods. And so we've done a similar Prisma style review of policies from 3 different databases, and we found 574 policy documents from around the world. And the key results are shown here, which is obviously you cannot see because I'm using a different content. So here, as you can see, there is the focus is primarily on external food environment domains. So again, we try to categorize these policies by the food environment domains to understand how these policies enable acquisition or consumption of animal source foods. And only the small green ones that you can see, which were related to price of animal source foods, focus on affordability of animal source foods were related to internal food environment domains. Rest of the policy documents, which are about just short of 600 policy documents globally in the last 6 years, focused on external food environment domains. And on the right, you'll see the map of where the policy documents are from. You can see that China has a lot of documents that they had produced in the last 5 to 6 years' time, whilst and same with Latin America, while a few countries in Sub-Saharan Africa and South Asia did not focus at all on animal source foods, terrestrial animal source foods. Here you can see vendor and product property and availability of animal source foods is clearly like a big focus of these policy documents. And there is, again, a lot of focus on milk and dairy products, and then meat in general to club together, and little on the other food groups that we've looked at. I think I'm going to stop there, and so we can get into discussions and unpack some of these results.
Right. Thank you for inviting me to give closing remarks. So as I said, I'm Sylvia Alonso. I'm a scientist at the International Livestock Research Institute. I'm a veterinarian by training, and then I became an epidemiologist. And I primarily work on the impacts of livestock production on human health. I do a lot of work on food safety. I've done a lot of work on zoonosis. And I've done some work at the interface between livestock production and human nutrition, so the role of animal production nutrition. So I guess my remarks are based on what I saw this morning, but of course bring in my own experience working on this space. So first, to congratulate FAO for setting off to do these literature reviews, because from my perspective, having been someone that have been trying to understand, should we promote animal source foods or not? Actually, as surprising as it might sound, there's no real consensus out there, even the nutritionists. Something as obvious as, is meat nutritious or this, or what is more nutrition, these and vegetables, you have different opinions. Some people say, yes, they are essential. Milk is essential for children. Others will say, no, really, they can eat spinach or something else. So actually, I think we need to understand, without an agenda behind, what is the role of animal source foods for nutrition? So this goes a good way to help us inform the discussions we have to have around the role of animal source foods for diet, for nutrition and health. But then what I will say is that as we move forward, we cannot just speak about animal source foods and do they have nutrients? Can they be good for health if you eat them? I think we need to look at it in the diet's point of view. And for this audience, which is full of nutritionists, I think, that's what we are moving forward. And us working on animal source foods, we need to adopt this diet approach. It's not, is it meat good, but within which diet, and hence how much? Because diets are diverse all across the world. Cultural preferences are different. So you are not going to promote, I don't know, cow meat in India, as good as that is. Or you might not promote milk in West Africa. There's not so much milk consumption. So I think we have to think on this discourse, we have to frame it within the context of diets and also cultural acceptability. Of course, also non-communicable diseases. So I think we really need to understand, and that was where my question was coming from, what is an appropriate and decent amount to consume. I think it's well established that a lot of amounts of meat, and especially processed meat, are not good. I'm not entirely sure we have been successful at moving people away from eating those amounts. I come from Spain, we consume a lot of processed meat. And in the US, of course, it's clear that there's a lot of consumption. Even when the evidence is there and the consensus is there, I think we are struggling to shift diet towards more healthier and sustainable diets. So that's one step forward. And then for someone like me working in low and middle income countries and sitting often in the debate of, we are promoting livestock production in low and middle income countries, we believe is good for the diets to support the nutrition of people whose diets are not very appropriate because they don't have access to so many products. So I cannot demonize animal source food, they are important. But then I also sit with my colleagues from the north who say, but it's so bad for the environment, livestock production is so bad for health, so bad for animal welfare. So why can you be promoting this? So I think, again, another area where we need to situate this discussion is in the context of the impact of livestock for the environment, livestock for animal welfare. And as we do that, I think, we've been saying we need to disaggregate our work by food, product, we need to disaggregate by gender, we need to disaggregate by country, and we're not doing that. I mean, the global debates are too global and are too polarized. And for those of us sitting in the middle, it's really hard to, we see both sides, but you can't bring those both sides together. I think we need to be brave enough and recognize that there's different countries, different worlds, and at least two globals, the North and the South, just to make it, use these generalized terms, because their recommendations have to be different. So I think we're also trying to find one bullet that applies to the entire world. I think that will not be the case. So I hope as we move forward on this area of work, we can also really start to be more specific as to what do we recommend to countries with in this kind of situation, and what do we want to recommend for countries where maybe animal source food is not only good for health, it's good for livelihoods, and is required to improve the diets. So I think those will be my remarks, and again, to congratulate you on the work and good luck with the subsequent steps. Okay, thank you, everyone.
Now we invite Chris Turner from Natural Resources Institute for a second set of closing remarks.
Well, thank you, everybody, and thank you for inviting me to give some closing remarks. So I've got a few points here to speak to. Broadly echoing, I think, what's been talked about today, we've covered a lot of ground in this session. I think this is a much needed area for more research into terrestrial animal source foods in relation to food environments, because this has been a bit of a blind spot for quite a while now in this area of research. So in terms of a couple of key points, I think, first of all, the findings from this review, I think, broadly echo a lot of the broader literature as well, and the findings that we found from previous reviews in terms of, the focus on high income country context, the focus on quantitative, descriptive approaches, and really also, as we've heard, the focus on either general food acquisition practices or a real focus on fruits and vegetables. And so this is, as I said, it's a much needed area. Also, the focus on this need and this call for improved methods and metrics in this area. Again, this is something that we found from a systematic scope review we did on food environment research in low-income countries, we published back in 2019, and it all really supports that, obviously with a much clearer focus on this specific source. I think also, it's been interesting this week to see that although, since sort of 2019 and pre-pandemic, this progress has somewhat stalled a little bit, obviously, during the pandemic in terms of development of methods and metrics. We've not been able to get into the field and test these things, but it was really interesting to see the event yesterday on innovative methods and metrics, and we're starting to see some of these quantitative approaches being developed now. And I think, some of those could be applied to this specific area as well. So it's nice to see that progress is happening. Obviously, these things do take time. Once we recognize the gap, to then start mobilize the research field and community and start to develop these methods and metrics. So that was the first point. The second one, I thought it was really interesting that we picked up on that disparity around vendor and product properties, and particularly in food safety, in terms of, it being an understudied dimension within food environment research. Despite that, there was this disparity again with, the real focus on the kind of policy and the regulation around this, which I think is what you showed in your slide there, Marouche. We know that food safety is a huge concern amongst consumers. Some of the qualitative research we've done in different areas as well. There's a whole field of food research around food safety, as we know, but it's not really been well integrated into food environment research as such to date. This is something we picked up also earlier, and you mentioned again, Marouche, earlier in the week, in the consultation that we had on the original framework from 2018, where we sort of recognize that need to elevate sort of food safety within the external food environment domain, as well as perceptions again in the personal food environment domain. So I thought that was really interesting. And also, you know, the talk around One Health. So this is something we've started to think about with some colleagues, with Delia Randolph and some colleagues at NRI, thinking how we might approach food systems and food environments from a One Health kind of perspective. And I think that's really interesting and a space that should be explored further. Also, I think they need to, you know, unpack these diverse food sources. You know, we had that comment there about the mice on the way from the airport, but obviously this has been a really interesting thing as we've sought to apply and test sort of some of these concepts in low middle income countries. We know there are diverse food sources, you know, market-based, could be formal and informal. You've got own production, you've got wild food harvesting, you know, all of these things are starting to come in. And I think, again, this is something where this particular area of research can add to that area. Yeah, and also, you know, Zip, you mentioned there about desirability and in the conceptual framework that we visited earlier in the week. And I think that's probably one of the dimensions which needs a lot more thinking and a lot more critical sort of investigation in terms of how do we sort of parse out some of those key aspects within that, because I think it was perhaps a little bit undercooked in the original conceptualization. And then finally, it was really nice to hear that we picked up on the gendered food acquisition practices around terrestrial animal source foods as well. Again, this is something that we find in many studies. I found it in peri-urban hydrobody in my own research as part of my PhD, but it also comes up all the time. And we heard yesterday, Greg Cooper and the team from the Stunting Hub have also found that as well in the bigger study that they're implementing from some of the summary high-level emerging findings. So yeah, I think I'll close with that. But thanks again. It was a really nice session. Yeah.
I think this comes to a close of the event. Thank you very much, speakers, everyone, participants. And if they want to access the report, they just
Yeah,
search for the
the
website.
access to links to the first document are already online on the ANH Academy side event page. So if you go to the side events page, you'll see the first document and all the recommendations from it that Tikian was talking about. The second document will be released sometime next year because it needs to go through the whole FAO council and all of those things. But we should have at some point have a peer-reviewed version of it online, and yeah, keep an eye maybe on the ANH page, and we'll hopefully try and put it on the Academy webpage. And if you have any recommendations and thoughts and feedback for the conversations we've been having today, please do come find any of us after this session and for the rest of the day. We'd love to hear more about what you are doing and what research you're doing and what we could learn from your project. So very happy to have a chat after. Thank you. Thanks for coming. I know it was the first event session of the day on the last day of the conference, which is not always the best time slot. So I really do appreciate you joining us today. Thanks very much. And also to our online participants, thanks for joining.